Data is not my friend. I do not like data. I know data, it's like a love-hate relationship. I remember going into the state health department and meeting EPIs, for the first time, and it was just they were into this data, and the way they could manipulate it was amazing. But that is totally not me. But I definitely value how they can, utilize data to help. And I forget what you were asking me about the question because data is like to me.
No, I love it. I love it.
Have to. I have to use it. But what I think one thing I think that kills me when I hear data, is I feel like individuals, especially I think about like community health assessments and implementation strategies. And number one, it's a lot of collecting an extensive amount of data, but there's really no logic. There's really no like end. You really have to think with the end in mind.
Mm.
You can't just go through data. Data is not the problem. It's what you do with the data that matters. Data without purpose is meaningless. Data without action is just noise. And so I feel like, there has to be a plan before you're just collecting data, especially when you're collecting it with communities who have been over surveyed and over analyzed. Number one, we already know what the problem is. So why are we asking the same question? We already know what the issues are. So what question can we ask to get the answer that we really need? How can we support each other in asking different questions so we can get what we need to get the support? And so, I've seen it from the other side, and I understand, like, from a grant perspective, I understand, like, I've had to fill out those grants and I've had to account for every dollar, for every person, and every resource. And so I get it. I get why data matters and why you have to, allocate for that. I understand. But it's just we have to, for people who are creating some of these grants and, requiring some of this data, come on, we got to think better than why are we requiring some of the things we're requiring? We got to think a little bit deeper. Yeah.
That's real in so many ways. And because it's like many people, when you get into public health and you continue doing this work, most of the time what the data is going to say about a same population, and asking, like, to your point, asking the question, is it going to change? You're going to be like, oh, okay, it still exists. And I think we haven't come to a point where we like the outcomes that we see are so predictable in bad ways, and yet we still, to your point, just survey people and ask them about the issues that we already know exist, but we aren't creating enough space to actually talk about how can we actually use data in a meaningful way to drive forward the work that's already there, or how can we use existing data and combine that with actual community voice and input. And like, as you're talking there, and no shade to anyone that works in community health needs assessments, I've worked in many community health needs assessments myself. I think they're very important documents. It's like, after that community health needs assessment is written, how many people in community are reading or interacting with that data in a meaningful way? I think there's a huge opportunity there to share back that data in a way that the community can really resonate and say, wow, this is, I didn't know this about this in my community, and now they might want to show up in a different way or have conversations with their neighbors in a different way. So I say that to say there's a lack there, and there's an opportunity for I think a lot of people that are listening to this to create ways to share more of that data holistically.
Well said.
Thank you. So before you shift to your like academic pathway, what does public health mean to you?
I think everything. I was just actually talking to my younger son, and he keeps. So I was wearing my shirt earlier from my college of Arizona, and he was like, that's where you got your doctorate. I was like, no, honey, I'm not a doctor. And so he thinks public health is it just is a doctor. That's it. And so I'm explaining to him like public health is this, it prevents all of these things. And he's like, oh wow, it's like it's really important. You do a lot of important things. I was like, yeah, we do a lot of important things. And I think, I mean, there were so many areas when I was explaining, it's like that we touch. It's just public health is everything. Public health is everywhere. We are all public health. I remember there was I think it was like an APHA or advertisement a while back during National Public Health Week, and it says we are all public health, and I loved that because we are. And I think if we walk with that kind of framework in our mind, and if we all kind of do our part of some sort of prevention or education, we are all public health. And so to me, public health is more about just looking out for your neighbor, looking out for yourself and your health and well-being, and looking out for one another. So that's what it means to me.
Yeah, I appreciate that, and as well as I appreciate that you are sharing what public health is to younger people out there, because I think there's so much value in knowing about public health and having a career in public health, or just the skill set and perspective on the world, and using that public health lens to make an impact wherever that is. And I think that is something that we need to continue to do very broadly. So I appreciate you sharing that.